Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
"1975 marks the 100th anniversary of the University of Michigan School of Dentistry. We think it is an appropriate time to review the history of our school. From Michigan's Dental College of 1875, the painstaking devotion of hundreds of dedicated people has culminated in the magnificent facilities which exist today. The historical narration in this presentation traces dental education at the University of Michigan through the buildings and clinics which have been provided for it. It is also a tribute to the untold number of individuals who have assisted in shaping the course of dentistry at Michigan.
Your host for this presentation is Dr. Charles C. Kelsey, Professor of Dentistry and School Historian at the University of Michigan School of Dentistry.
Many changes have occurred in dentistry at the University of Michigan since its beginning in 1875. From its first home and a faculty of 3, it has become a leader in dental education, dental research, and patient care. But to better understand and appreciate the present, it is important to review our past. In the mid-1800s, there were very few dental colleges in existence. Most dentists were trained under preceptorships. The only dental school in the West was the Ohio College of Dental Surgery in Cincinnati. No dental college was connected with the university. In 1865, a 5-man committee of the Michigan State Dental Association, headed by Dr. Jonathan Taft, one of the nation's most eminent and respected 19th century American dentists, petitioned the regents of the university to establish a dental chair, which would be the first dental school in the country to be connected with the university. The proposal was rejected because of the lack of funds. In 1866, 1873, and 1874, petitions to establish a dental school at Michigan were again presented to the regents, but each time the proposal was rejected. On February 24, 1875, Representative Edward L. Briggs introduced House Bill 518, which would, quote, provide for an appropriation to enable the Board of Regents to establish and maintain a dental school in connection with the medical department of the state university, unquote. After several weeks of debate and a near defeat, it was passed by the House and Senate on April 27th and 28th. On May 1st, 1875, Governor John J. Bagley signed the measure into law. The Board of Regents approved the measure on May 12th, 1875. The same law established a homeopathic medical college and directed that the new colleges be housed together. The Board of Regents was awarded $3,000 for each of the years 1875 and 1876 to establish and maintain the dental college. Entrance requirements were the same as for law and medicine, a high school diploma. The course of instruction included 2 terms of 6 months each, in addition to 1 year of apprenticeship in a dental office. A faculty of 3 was appointed to educate the first class of 20 dental students. Dr. Jonathan Taft was appointed Dean and Professor of the Principles and Practice of Dental Medicine and Surgery. Dr. John A. Watling was appointed Professor of Clinical and Mechanical Dentistry. The appointment of Dr. Walter H. Jackson as Demonstrator of Dentistry completed the first faculty of the Dental College. The first home of the Dental College was in a university building which had served as a residence for Professor George B. Merriman. It faced north on North University Avenue on the present site of the Natural Science Building. The two-story structure was remodeled to provide classrooms on each floor. A small dental laboratory was equipped in the basement. 9 students graduated after the first year, the class of 1876. By 1877, enrollment had doubled. Lack of space and rivalry between the dental and homeopathic students created the need for larger quarters. The second home was another one of the professors' houses. It was located across campus at the approximate site of the present William L. Clements Library on South University Avenue. The Dental College was the sole occupant of this building. Laboratories were established in a former woodshed. The annual appropriations for the Dental College was increased from $3,000 to $4,500. After only 1 year, the crowded conditions prompted the Regents to authorize the construction of a permanent addition to the building. By the winter of 1878-79, the east wing was completed at a cost of $3,250. The second floor was used for the dental operatory, and the first floor housed a laboratory. By 1885, the increased number of students caused an overflow of 6 dental chairs to be used in the lecture room. Dean Taft presented plans for another addition to the building. He was refused because of the lack of funds. In 1889, the curriculum of the Dental College was extended to 3 terms of 9 months each. By now, the facilities were so seriously overtaxed, a move to larger quarters was of paramount importance. This situation was finally relieved in the fall of 1891. The Dental College moved into its third home. This was another one of the professors' houses, located on North University Avenue, on the present site of the chemistry building. It had been recently vacated by the University Hospital. 2 one-story frame wings had been added to the original stucco house for use as hospital infirmaries. It was here in 1894 that the Dental College became the first to provide graduate dental education. The first recipient of the graduate degree was a woman, Carrie Marsden Stewart. One advantage of this building was its relatively easy adaptability to necessary changes. Throughout the years, many improvements were made, such as enlargement of the museum and the addition of a skylight to the lecture room. Although there were gas lights in the center of the clinic, students complained the lighting was not adequate for performing dental work in the late afternoons, particularly during the short winter days. This situation was overcome, however, during the Christmas vacation period of 1896-97. The Board of Regents moved that the auditing board be authorized to put electric lights in the clinical laboratory at a cost not to exceed $60. Possibly the oldest living alumnus of the School of Dentistry is Dr. Albert Wildanger, class of 1897. During an interview on November 29th, 1972, Dr. Wildanger recalled some of the events during his dental education.
Well, the gymnasium must have been built while you were in school.
Yeah, it was.
It wasn't it? Yeah.
Oh, yeah. I played baseball where that gymnasium is.
Did you?
Yeah.
Now that's marked that was the library in that building.
Yeah.
The library. And the woman sitting here at the desk is labeled Miss Hubbard.
Oh, no.
Do you remember Miss Hubbard?
Yeah, oh, yeah.
And she was a librarian, but I think she did a lot of other jobs around the
Yeah.
school, didn't she?
Oh, yes. There wasn't many like her there.
Remember your days in there?
Well, I should think I did. Oh,
it was.
A long time ago.
Do you remember the kind of anesthetic they used at the school for their work? If they used any at all?
I know they had a hell of a time.
I've come across some references to injecting cocaine right in the gum once in a while.
I should say so. I was scared to death. 2 or 3 of them, I'd laid them out. God, I thought they was dead. Scared me. I didn't know what to do. In fact, after I graduated and come back here, it was a hell of a thing.
Well, a couple of people I've talked to have remarked that they didn't take out any teeth at
Well,
school.
I did. I know that.
Did you?
Because I had taken out teeth before I got there. I was with Doc's office. He used to figure, says, if I'm not around, they want their tooth out. You take it out.
I see.
So, I says, all right, Doc, I'll take it out. I don't know anything about it. Oh, dear, what a funny thing. Oh, Dr. Miller.
But I understand you didn't do much prosthetics. You didn't make many dentures in school at that time.
No.
Do you remember making
Yes, I remember.
a denture at the school?
I spent 3 years here with Doc Miller.
Oh, did you really?
And I was making his dentures and everything else.
Oh, is that right?
Then I went to Ann Arbor and went through the college.
Oh, I see.
But I was 3 years in his office.
Oh, I see. That must have been a big help.
Oh, it was. Oh, heaven, marvelous. I got $7 a week.
Is that right?
Oh, boy, cash. Yeah. Doc got $20 for an upper and lower set of teeth. That's what I got afterwards. Boy, that was a long time ago. Yeah. I don't believe there's a kid left in my class.
Don't you? Probably not. I don't know.
I don't think there's a one.
For more than 25 years, Dr. Jonathan Taft worked to establish, maintain, and constantly improve dental education at Michigan. In June of 1903, he resigned as dean. Dr. Taft passed away on October 16th, 1903. The Jonathan Taft Honorary Dental Society was founded in 1967 to further the educational abilities, ideals, and traditions of the University of Michigan School of Dentistry. Dr. Cyrenus G. Darling had been named acting dean on the resignation of Dr. Taft. With Dr. Chalmers J. Lyons, Dr. Darling organized and established the cleft palate and hair lip surgical service in the University Hospital, which became the largest clinic of its kind in the world. Dr. Willoughby D. Miller was appointed dean in 1907. He was considered the outstanding dental scientist of his day, whose research in dental pathology and bacteriology laid the foundation for our present knowledge of biologic dental science. Dr. Miller came to Ann Arbor in the summer of 1907, but died from appendicitis during a visit to his boyhood home in Ohio before he could assume his duties as dean. Dr. Nelville S. Hoff was appointed acting dean upon the sudden death of Dr. Miller, and in 1911 was appointed dean.
By the turn of the century, the dental college's third home had become totally inadequate. But the hopes of the college were materializing. University President Angel called for an entirely new building to be constructed for the sole purpose of educating young men and women in the dental profession.
Property on the east side of North University Avenue, the present site of the new School of Dentistry Library, was purchased for the dental college's fourth home. Construction began on the new building in 1907 and was completed and occupied in October of 1908. The new dental building was a 3-story fireproof structure which contained a large amphitheater and lecture room, 2 technical laboratories, a surgery clinic, radiography room, library, offices, research laboratories, and on the 2nd floor, a spacious, skylighted general operative clinic. Although foot-power dental engines were still used, electric dental engines were installed a few years later. It was in this building in 1911 that the first of 3 generations of Haywards completed his dental education. On the left is Dr. Roy G. Hayward, class of 1911. In the center, his son, Dr. James R. Hayward, June class of 1944, MS 46, and chairman of the oral surgery department. On the right, Dr. James S. Hayward, class of 1972. This is Dr. Roy Hayward at chairside during his senior year. He talked with us about his clinical experience in dental school.
I made one partial denture while I was a senior out here.
Any dentures at all?
One partial.
One partial.
That's all the denture work I did in Ann Arbor. In oral surgery, I extracted one root of an upper first molar that was just ready to pop out anyway. Of course, I had the lectures, they told us how to do it. But we didn't have the clinical material.
That's what I was going to ask. Was there a lack of clinical material?
A lack of clinical material.
How about anesthetic? What did you use for anesthetic in 19?
We used cocaine locally. A 2% solution of cocaine injected just around the gingival margin.
I see. Can you remember, did you anesthetize for restorative work or not?
No, we didn't.
No anesthetic at all.
And they taught us cavity preparation, your black cavity preparation, exacting and had to be perfect and all this. I got out and tried to practice dentistry, and I was hurting people so that after about 2 years of it, I was ready to give up and go back to my other job. I started out to be a captain on the lakes.
Is that right?
And my father was, and I got up to be a wheelsman.
Is that right?
And then I studied dentistry, but if it hadn't have been for conductive anesthesia coming in, I don't think I would have been followed the dental profession.
Let me ask you about Dr. Hall.
Louis P. Hall?
Yes.
Oh, gee, he was the grandest man that ever lived.
He taught what now?
Well, he was in the clinic. He was, if you got in trouble, call Louis P. Hall, and he'd come and help you out. And never criticized you, always kindly. He was a friend of every student, every senior. We all loved him.
Many important changes were made to the building in order to meet the needs of a rapidly changing profession. An addition in 1923 increased the floor space by almost 20,000 square feet, and the clinic then contained nearly 200 dental operatories. In 1949, the main operating clinic was completely rehabilitated. It was outfitted with all new dental equipment and cabinetry. For the first time, each operatory was partitioned to provide patients and students more privacy during treatment. Several changes and important additions to the curriculum occurred while the dental college was located in its 4th home. In 1917, a 4-year curriculum was adopted. In 1921, a dental hygiene curriculum was established. In 1922, it was the first dental college to offer graduate training in orthodontics, leading to the Master of Science degree. And in 1927, the school's name was changed from the College of Dental Surgery to the School of Dentistry.
Meanwhile, in the late 1930s, the W.K. Kellogg Foundation and the WPA, in cooperation with the dental school, developed a plan to erect a building specifically designed for the purpose of providing postgraduate instruction in dentistry.
The residence on the corner of Fletcher and North University Avenue was demolished in the fall of 1938, and construction began immediately. By the spring of 1940, the building was completed. With the construction of the Institute, the University of Michigan established the first building in the world to be devoted solely to graduate and postgraduate teaching in dentistry. During these years of growth, 3 outstanding men served in leadership roles at the dental school. Dr. Marcus L. Ward served as dean between 1916 and 1934. He established the school's Laboratory of Physics and Chemistry and developed it into a research unit of international reputation. Dr. Chalmers J. Lyons, a widely known and highly respected oral surgeon, served as chairman of the executive committee in 1934-1935. Dr. Lyons died in 1935, less than a year after his appointment as head of the school. Dr. Russell W. Bunting, who was actively involved in the study of the cause and control of dental caries, was appointed acting chairman upon the death of Dr. Lyons. In 1937, he was appointed dean. Dr. Bunting directed the Dental Caries Research Group, which reported findings that later served as the basis for the present method of caries control by dietary means.
Continued growth and change in the dental profession created new demands for dental education. The undergraduate dental and dental hygiene student load had tripled since 1923.
In 1950, Dr. Paul H. Jesrick, who was influential in organizing the early postgraduate teaching which the school pioneered, was appointed dean. The shortcomings of the existing dental building and the need for a new one were presented to the university administration in 1953. In December of 1964, the Board of Regents approved a project budget of almost $15 million for the new dental building, including improvements in the W.K. Kellogg building. The project was to be financed by state appropriations, federal grants, and private gifts and grants. The building project was the largest building contract ever made in the history of the University of Michigan. Dr. William R. Mann was appointed dean in 1962. Dr. Robert E. Dorr was appointed to the newly created position of associate dean. Under this leadership, the planning and building of the dental school complex began in February of 1966. In 1967, remodeling of the Kellogg Institute began. The building project was accomplished in 2 stages. First, the clinical and research wings were completed and occupied by the fall term of 1969. Then the old dental building was demolished in the late fall of 1969. And work began immediately on the library and Kellogg wing. The project was finally completed in the spring of 1971 at a cost of approximately $18 million. The new dental building houses the most advanced technology and equipment for teaching and research. The school's instructional television system includes a large studio, broadcast quality color cameras, and tape machines. Classrooms are equipped with color TV monitors. The photography department includes a complete high-speed developing and processing system. The facilities also include an individualized learning center, where carrels are equipped with automated study aids for programmed learning. The library, which contains 40 study carrels and reading areas for 200 students, is considered one of the finest dental libraries in the country. There's a new dental laboratory where orthodontic, gold, complete denture, chrome cobalt, and ceramic restorations are prepared. A wide range of dental research facilities is located in the research wing. The faculty alumni lounge, located on top of the research wing, is used for committee and alumni meetings, receptions, and special seminars. These are the freshman and sophomore preclinical laboratories, with 154 workspaces in each laboratory. There are 3 lecture rooms, each with a capacity of 156, in addition to numerous seminar rooms and offices. Senior and junior clinics are located on the 2nd and 3rd levels of the clinical wing, with a total of 144 partitioned operatories on each floor. In addition, specialized clinics are located in the clinical wing. And this is one of the 3 spacious waiting rooms adjacent to the clinics. These new facilities have allowed some important changes to be made within the School of Dentistry. The dental student class size has increased from 97 to 150. Dental hygiene student enrollment in each class has increased from 39 to 80. Graduate students have increased from 67 to 125. This represents an overall increase in enrollment of nearly 70%.
From its beginning, the ideal at the University of Michigan School of Dentistry has been high standards and professionalism in dental education. 4 of its faculty members have been president of the American Dental Association. It was the first dental college to be organized as an individual part of a state university, and the second dental college to be connected with any university. It was the first school to offer a program on the graduate level. The Kellogg Institute was the first building in the world to be devoted solely to graduate and postgraduate teaching in dentistry. And in 1967, the Dental Research Institute was established to formalize, expand, and better organize research relevant to oral health.
The first 100 years has seen many changes in dentistry. The future promises even more. It offers great opportunities and new challenges. But as Dean William R. Mann has said, change has become the byword at the School of Dentistry. These new facilities are a fitting tribute to the 100 years of dental education at the University of Michigan, and to the faculty members, alumni, and supporters who have contributed to the high professional standing of dentistry and established the ideals and traditions at the University of Michigan School of Dentistry.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.